In recent weeks, the Gambia have witnessed a surge in the number of coronavirus cases in the country. As of Saturday, we stand at 205 active cases and have registered 6 deaths in the country. And today we sit down with the Director of Health Promotion and Education, Mr. Modunjai, to ask some questions. Mr. Njai, my first question to you is, how did we get here to this stage?
Thank you very much, Sajo, and thank you for coming here. We really reached to this stage. For me, it might be a surprise to many, and to many, it has been predicted that our peak period might be between June, July, and then that is what we are also experiencing because of one. There's an increased number of people traveling, and also increased number of people also who have been coming through the land borders and sea route, like air route, and then that's the airport. When those waves were open, for example, and then the people started coming in, and most of the people when they come in, they're taken to quarantine, and then before they start that quarantine period, what we have not been doing before, that is like when people are getting into quarantine, they are not screened at that time. But now that it's mandated, now anybody who comes in will be screened, and when they are screened, and then they will be at quarantine. If they are positive, they'll be taken to the treatment center. So they'll be having at least 2 consecutive tests. That is, before they also complete their quarantine, they'll also be screened again and they tested. And then if they are also negative, then they are discharged and then go to their families. Perhaps we have also strengthened our screening. Because some time ago we started seeing number of cases increasing when we did the mass testing in Bakau. I think you are aware of that. And then again we started moving on. We started engaging communities. We started the sensitization. More and more people build the interest to come and test voluntarily. And as a result of many people coming forward for testing, it's also giving us at least a yardstick as to where we are. And that is why we have seen this increase in the number of cases, because many people are also responding to the testing, and this is done on a voluntary basis. We've also realized that certain people, with the belief that the disease doesn't exist, and we have done series of campaigns around that. We've also done engagement of borderland communities for them to be able to strengthen border surveillance, and as well as also strengthen community-based surveillance. This has also been done. And when all these activities have been done, people also started coming up to realize the need for them to go to testing, and also realize the need for them to adhere to the precautionary measures. We have also realized that there is a relapse in the behaviors of people in terms of, most specifically, hand washing. People have been washing hands with soap on a regular basis. At the beginning of the pandemic, people were so serious about it.
But as time goes
on, people went into the level of relapse. And then, oh yeah, it's a disease, oh, we are used to it. So people feel that they are used to this and they are used to the messages. And then that is why many people in many communities, we have not seen the hand washing station being functional. We've also not seen many people practicing hand washing with soap. So this could be another contributing factor. We also realized that at the beginning of the pandemic, the public health the health emergency regulation was passed and it was adhered to at the beginning. But as time goes on, people did not tend to adhere to the regulation. And then we witnessed series of programs that festivals, marriage ceremonies, naming ceremonies, ongoing at both the urban and the rural areas. And that has also brought in concerns, and then people started interacting, people were not observing physical or social distancing, and then at the time, people were also not putting on masks. And as we move on, we also see a surge in the cases.
Number of cases.
We've also realized that at the beginning of the pandemic, health workers were not affected. And now that health workers have been affected, and some of them have the virus, it also triggering many people also to come forward, many health workers and non-health workers now, to come forward to do the testing. Perhaps this is why we are seeing this number of cases over this 20 days period, where we had registered over 90% of our cases within this period, and I think an increase in the number of cases.
These are really scary and complicated times.
Yeah.
There seems to be panic going on
Yeah.
In the community.
Yeah.
But people continue to show this lackluster attitude towards this pandemic. But this is a time we cannot afford to be complacent.
Yeah.
What do you have to say about that?
We know there is a bit of panic and fear among certain community members in certain localities. Because what we have seen now coming is the issue of local transmission or community transmission. I mean, in transmission of about 90% of the people who got the virus within the last 2-3 days were linked to, we are not linked to any travel, I would say.
So
because
these are basically all
these are
local
people who they've not gone anywhere, they've not traveled, and then they have no history of travel for the past days or weeks or months, and then they had the virus. So that's a concern. And then what we are trying to say is that that is where we need to do more, and that is what is causing more panic among some people. Because we were not expecting that large number of community transmission cases. But it has happened. What do we do? At the beginning, it has been a challenge to get people to accept or to adhere to our messages. It has also been a challenge to convince people to practice physical distancing or social distancing, and also to put on masks. We've also seen an instance where one person will wear the mask, go out to the public, do the business, and come back and put that mask down. Another person who wants to go out will also use the same mask.
These are things that we
also
cannot
seen
do.
that. So we are now saying one mask, one individual for any time you are going out, and if you can even have 2 masks or 3, so that you can also be able to clean this mask. And if you wash it and dry it, kindly iron it, at least to make it more safe for you when you wear it. That's the message we have been sending out. But we have seen a similar thing like that. And Sergio, you'll bear me witness that if you go out now, you see different types of masks. Some you don't even know what are they putting on, and those are not masks, because you see that some of them will put on very thick materials. Some will even have nylon or sort of, and we are encouraging at least cotton. At least, if you don't have the surgical mask, and you want to go in for locally made mask, we are encouraging people to use cotton. That has some sort of holes that can also allow you to breathe at least normally. It may not be 100% normal in the breathing, but at least can be better than a material that has been thick enough. That can even obstruct your breathing, and it can also result to
it can cause further complications for asthmatic patients.
So we are really encouraging people to look for advice, go to the Standard Bureau or contact health workers around you to advise you as to what type of material to be used. We have all witnessed it together, that we have seen the number of cases. Sergio, as of Saturday, we registered 61 new cases. 61 new cases. That is scary. And the highest ever reported number of cases in the country on Saturday.
So the state of public emergency has elapsed?
It has elapsed. And it has been, eased for that matter.
It has been eased.
And then now it's been replaced with the Public Health Dangerous Infectious Disease Protection Regulation 2020.
And cases are still increasing as the days go.
Exactly.
And these are all locally transmitted. This is a scary question, but Mr. Njai, what are we looking at here? Could this get worse?
If we don't change our strategy, if we don't change our behaviors, if we don't change the way we think about COVID, we are going to see a dangerous trend, an unpleasant trend in COVID-19. We're going to witness the number of cases of COVID to be increased, And most likely, if we don't change our behaviors also, we might see a surge in the number of community transmission. And that's going to be the biggest fear. So that's why I'm saying I am positive. And I'm also convinced that the public will adhere to our messages. Because knowing the number of cases being increased, like for example, at some point we had about 31 cases. The following day we had 46 cases. And then the other day we had 61 cases. That is scary. So that is also, ringing a bell in all of us to say that we need to tighten our belts. We need to strengthen our strategies. We also need to be focused in our intervention. We need to ensure that people put on masks at all times, wherever you are going, for example, in public. We need to ensure that people practice physical distancing. We also need to ensure that we continue the practice of hand washing with soap and water at regular times. And then also we need to know when we go out what we need to touch. Surfaces, the virus can stay in the surfaces. We know that for some time. So it's important that we are mindful as to what materials do we touch. And if we touch them, we need to go back immediately. Either we have sanitizers with us or we look for water and soap to wash our hands. In my view, Sergio, I think if we do all these activities and all these strategies, within the next 3 weeks, we strengthen our strategy, we tighten our belts, we listen to the messages coming from the Minister of Health and partners. I think we can be able to flatten the curve. Mm-hmm. But my fear is we are getting into the Eid. And people will travel from the urban area to the rural areas. This is the time
we are going to witness the highest rate of internal migration in the country.
That is where my fear is.
Are you worried about
that? And I'm worried about it. And my advice, my candid opinion to brothers and sisters, family members, my children, daughters, I want to advise that people in the urban area need not to travel to the rural areas to at least to witness the Eid. Simply because you don't know who is traveling from the urban area to the rural area. We don't know who has the virus. Many people are asymptomatic. They are not showing any signs and symptoms.
Which is even the worst, because...
And then it could be the worst. And they will not be known, they will not have possessed any signs and symptoms.
And they continue carrying on and transmitting to other people.
And that is my fear. And I would want to advise candidly for people to relax. Those going to the provinces, just for now. It may not be a longer period.
So now
in the next 3 weeks. But the people who are going, I want to advise that let them relax.
To probably
stay around until the epidemiologists, the surveillance team are also doing their work, and they're studying the situation, and they'll get back to us as to what advice we can do. That is my advice for now. I'm sure it may be a difficult advice for people to take, but that is the advice I want to give for now, and I think people will listen to us. We have been frank to each other over the months, and the communities, we have been listening to them, and they have been listening to us, and we appreciate. Anytime we have programs, they call in to give us their opinions, and we respected those opinions and suggestions. And most of the activities we are implementing is as a result of the suggestions coming from the community members. So meaning that we have high regard to their opinions, and we also want to appeal to them to listen to us on this, especially at this crucial moment, where we need to listen to each other so that we can be able to contain the virus. It is not easy, Sergio, to see our own colleagues going through the pain of the virus. I mean, they are currently admitted. Some of them are in the various locations. The day we reported the 46 new cases, almost 17 to 18 of our staff are from this very building. So it was not an easy task for us.
These are people who are in the front line.
These are people who are working, protecting the people. And they are the ones that are the link between us and the people. And they are the ones who are going working directly with the public community. And these are the people who are helping us to collect the samples. These are people who are communicating who are doing the contact tracing, who are doing the rapid response. This is where we have our challenges. So we want to advise the public just to listen to us for now, for the next 2-3 weeks, and we'll see what will happen.
And finally, before I let you go, Mr. Njai, the state of public emergency have been eased, like you said.
Yeah.
It is normal. But something that felt like a bitter battle between the executive and parliament, we have to extend. It should not be because, for whatever reasons. As someone who have been in the front line and as a health personnel, what is your opinion on whether the state of public emergency should be brought back?
So the regulation, the Public Health Act or the Public Health Regulation protecting the public from infectious or dangerous diseases, even without the state of public emergency, if it is effectively and efficiently implemented, we're going to see positive results. It's talking about isolation, quarantine, protecting the people who refuse to be quarantined, what penalties are there, what can be done by the minister or the health officer, people who jump treatments, people who escape from treatment centers or whatever, what can be done. And the role of the community also is very crucial in this. So for me, the state of public emergency can be brought in. If not, we continue to implement the public health regulation, which really is in line with the state of public emergency regulation. So for me, I think it's just a matter of protecting the population. The state of public emergency is out to protect the population. The health of the population is the interest of the state. And that's why the state decided to put up that measure to ensure that people are protected. So therefore, the state of public emergency regulation is there to help the people. And then when it started newly, people were avoiding crowds. There were no programs. But when it was lifted, it was just like, wow.
Business as usual.
Business as usual. That was what we could see. And that was where we started having problems when it was lifted. Remember the day it was lifted? We had some new cases. About almost 46 cases a day. That was what we reported.
And it has been increasing.
It has been increasing since then. 46, 61. We don't know. That of yesterday, on Sunday, we have about 30 cases or so. And today, added to it, we might have about 50 or so. I'm not very sure. But we'll get the details in the next 2-3 hours.
Mm-hmm. Thank you very much,
This is what we need to do. Yeah.
Thank you very much for granting us this interview. That's the Director of Health Promotion and Education there, Mr. Mamadou Njai. Thank you very much, sir.
Thank you.
Thank you.